Hey guys, this is Dr. Herb. Today we will compare the Erbs and the kumpkes palsies. So Erbs and the kumpkes palsies, the first one we will be looking at the Erbs palsy. So Erbs palsy, what are the causes? The causes of the Erbs palsy is going to be due to the undue separation of the head and the shoulder. So this undue separation, and this separation will be of the head and the shoulder. We are writing it as HNS. And here the upper plexus root is involved. So the upper plexus is involved. Then next we have a question on the examples. The example will be the shoulder dystocia at delivery. So it will include the shoulder dystocia. So it will be the shoulder dystocia, and this will be at the delivery. Next, it will also include the motor vehicle accidents. So the question arises on the nerve roots. So what will be the nerve roots here? The nerve roots involved here will include the C5 as well as the C6. So what will be the muscles involved? The muscles involved, it will include the deltoid. So there will be a deltoid muscle. There will also be the supraspinatus. So deltoid muscle and the supraspinatus muscle. So they are involved with the loss of the abduction. So abduction is anything that is away from the body is known as abduction. Then what is other muscles involved? It involves the infraspinatus. So infraspinatus is nothing but the loss of the lateral rotation. So there is loss of the lateral rotation. Next comes the question on the BB. BB means the biceps brachii. Biceps brachii is it is involved with the loss of the flexion and the supination. So there is loss of the flexion as well as the supination. Next comes a question on the position of the upper limb. So question on the position. So question is on the position of the upper limb or the hand. The position of the upper limb of the hand. So what does it include? The upper limb of the hand, it includes the policeman tip. So it is nothing but the policeman. It includes the policeman tip or the porter's tip. The porter's tip. So policeman's tip or the porter's tip position. And then we look at the sensory loss. So is sensory loss present or not? So looking at the sensory loss. The sensory loss, it is seen in the outer aspect of the arm. So it is in the outer aspect of arm. Next we look at the ANS signs. ANS signs is totally absent. Then we move on to the kumpkes palsies. Kumpkes palsy. So this kumpkes palsy, what is the causes? The causes, if you see, it includes a hyperabduction of the shoulder. So there is hyperabduction. Hyperabduction is of the shoulder, and there is a lower root plexus. The lower plexus root is involved, whereas in Erbs palsy it was the upper root. So here is the lower root plexus. If you see, it is involved. So what are the examples of the kumpkes palsies? So the examples of the kumpkes palsies, it includes, there is a difficult breech delivery. There will be a difficult breech delivery and holding on to something. So, or by holding on to something. So what is meant by holding on to something? Example, you can have a branch. Example will be a branch, or during a fall, or you can say during a fall, or it can be due to the cervical rib syndrome. The cervical rib syndrome. Next, it can also include the scalene syndrome. There is a scalene syndrome. So what are the nerve roots which is involved? The nerve roots involved in the kumpkes palsies is going to be the C8 as well as the T1. So C8 and T1 is involved in the kumpkes palsies, whereas in Erbs palsies it was the C5 and the C6. So question arises on the muscles which is involved in the kumpkes palsy. The muscles involved is nothing but the all intrinsic muscles of the hand. So it includes the all intrinsic. intrinsic muscles, and this is going to be of the hand. Next, we look at the position of the upper limb of the hand. So how is the position? The position of the upper limb or the hand. So the answer to this is claw hand. There is appearance of claw hand. And question on the sensory loss. The SL, that is the sensory loss, it is present along the medial border of the forearm and the hand. So it is along the medial border. Along the medial border, and this is of the forearm and hand. So it is on the forearm as well as presence of the hand. Now let's look at the ANS signs. ANS signs, it includes the presence of the Horner syndrome. So there is presence of the Horner syndrome is nothing but the ANS sign.